Hi everyone and welcome again to this next lecture on a very important topic, and the topic, as you can see, is our pharyngeal arches. Hi, I'm Dr. Ankit Khandelwal, Professor Anatomy, and welcome to our YouTube channel Human Anatomy. So in this particular image, what we are seeing is the all the cartilaginous and the skeletal derivatives of the different pharyngeal arches. First of all, we should know that there are 5 pharyngeal arches, right from number 1, then we have number 2, then we have number 3, then we have number 4, fifth one is missing, then we have number 6. So in this particular image, you can see all the different color codings, right? So this orange color is the number 1 pharyngeal arch. What it is giving rise to, we'll see in the table form also, but here you can see the mandible, the medius incus. This blue color is the second pharyngeal arch. As you can see, it is giving rise to stapes, styloid process, stylohead ligament, and other processes, or the upper part of head bone also. This yellow color is the third pharyngeal arch, and you can see it's giving off the greater horn of the hide bone plus the lower part of the body. This red and green color, they are the fourth and the sixth pharyngeal arches, skeletal derivatives or the cartilaginous derivatives. You can see they are mainly giving rise to the laryngeal cartilages, right? So these are all the different cartilaginous and the skeletal derivatives, which you can see from the table also. The reference is all from the Langman's embryology. In this table, we can see that on the different, there are 4 different columns. The first column over here is about the pharyngeal arches. We have the first arch, the second arch, the third, fourth, and the sixth arch. The first arch is also known as the mandibular arch. The second arch is known as the hyoid arch. The third, fourth, and sixth have no specific names. The second column, you can see all the nerve supply of different pharyngeal arches. Very, very important. The first arch, the nerve for it will be the trigeminal nerve. Basically, it's maxillary and the mandibular division, and mainly it's the mandibular division. The second arch, the nerve is the facial nerve. For the third arch, it is the glossopharyngeal nerve, and for the fourth and the sixth arch, it is the branches of vagus. Mainly, we have over here the superior laryngeal nerve and the recurrent laryngeal nerve. Now, all these different nerves which you are seeing over here, if you study neuroanatomy, they come under the superior spatial visceral efferent cranial nerve nuclei columns. The third column over here are all the muscle derivatives. You can just have a look of it. You can take even the screenshot, that will help you. So what all these nerves supply the muscles, they are all written over here. And the fourth column over here is about the skeletal derivatives, which we have slightly seen in the upper image over here. Let me show you the image once again. These are all the skeletal derivatives. So a bit in detail, but yeah, all of these are important. You have to go through it. So I advise you to take a screenshot and then go ahead with it. So let's move ahead, and in the next image, what you're seeing over here is basically we are looking at a coronal section. I hope you know the coronal section, which divides the body into anterior and posterior parts. Okay, so in the center, what we see is the development of the tongue over here, and on the sides, there's a brownish color. We are looking at the pharyngeal arches. The white numbering over here is for the numbering of the arches, and the black numbering are for the pharyngeal pouches. What are pouches? Pouches are from the inside. If you look at from the inside, because inside we have endodermal, so these pharyngeal pouches are basically endodermal in derivative, right? So we have 5 arches over here, 1, 2, 3, 4, 6. In between, we will have around 4 pharyngeal pouches. Remember this. This black number over here are 1, 2, 3, 4. And the different derivatives are being given over here. Let us just briefly go through it. For the first pouch, again I repeat, it is endodermal from the inside. The first pouch is basically over here. If I highlight, it is a tympanic cavity and the auditory tube, as you can very well see. Okay, from the second pouch, we have the palatine tonsil. From the third pouch over here, we have the inferior parathyroid and the cervix and the thymus over here, not the cervical sinus. We'll talk about it. On the fourth pouch, we have the superior parathyroid and the ultimobranchial body. These are derivatives you will see in the tabular form also. Now these are from the inside. From the outside over here, what we call them as pharyngeal cleft over here. And they are basically ectodermal. And in between the cleft and the pouch, we have the mesenchyme or the mesoderm in between. So what about the pharyngeal cleft? Actually, what happens is the second arch over here, the second arch from the outside, it grows down and it covers all the remaining clefts or the ectoderm below. So actually there's nothing much left for the pharyngeal cleft, okay, but whatever is left is basically coming from the first pharyngeal cleft, and that is our external acoustic meatus, and you can see the outer part of the eardrum, that is coming from the pharyngeal cleft. So I repeat again, it's a coronal section. We are looking at a derivatives of pouches. We'll see in the tabular form also over here. Again, all the references are taken up from the Langman, so you can totally rely on it. And these are all the different pouches and their derivatives which we already discussed. A small mnemonic might help you guys over here. This third pouch over here, what we write it as THIRD, THIRD. So I always try to write it like this. THO refers to the thymus, I refers to the inferior parathyroid gland. Okay, that will help you. Now moving on to the further part of the pharyngeal arches over here, a couple of images showing you the swelling over here. What is this? This is just, you can see, cervical sinus, which was being discussed over here a bit. So what actually happens is when the ectoderm is not able to completely cover, when this ectoderm, all the second pharyngeal arch which goes down and covers all the remaining pharyngeal cleft, when they are not able to completely cover, then there are some cervical sinuses which are left. Here you are seeing this cervical sinus, or you can call it as a branchial sinus also, okay, or lateral cervical sinus, whatever names you can call it as. Remember its location, it is normally below the angle of mandible, and it is right in front of the sternocleidomastoid muscle. This will be the SCM muscle over here, right in front of it. Just to differentiate it, you have seen over here a thyroglossal cyst also, which is very close to the midline. And whenever there is protrusion of the tongue, this thyroglossal cyst will try to pull up. That's the difference between these two common congenital conditions. Let's move on to one other situation. And what is this? These are all the aortic arches. Okay, let us look over it in a bit detail. Here what we are seeing is these are again the 1 to 6 aortic arches. So these are the arteries of the different pharyngeal arches. Okay, now what happens is as you see the further development in this particular image, you will see that this first pharyngeal arch aortic derivative, or the first aortic arch, the second aortic arch, and this one the fifth over here, they start to disappear. Okay, so what we are left is the third one, the fourth one, and this purple color sixth one. These are basically what is left. Okay, and this yellow color, the nerve that is coming down is basically our vagus nerve. What is it? It is basically the vagus nerve. On both the side we have the left vagus over here and the right vagus over here, and what is giving rise to these are the recurrent laryngeal nerves, the right recurrent laryngeal over here, and this over here will be the left recurrent laryngeal. Now, a lot of questions which come from here, let me try to tell you. What you are seeing over here is also that these green color which I'm highlighting now, these are the aortic arches which are starting to disappear, the first, second, and the fifth one. Okay, now if you look at the derivatives, you will see over here that the third aortic arch derivative mainly gives rise to your carotids, basically common carotids and the internal carotid. The fourth aortic arch on the left side and the right side has different derivatives. On the left side it gives rise to a part of the arch of aorta, on the right side it gives rise to a part of the right subclavian. Don't worry, we have a table also for it. The sixth aortic arch gives rise to the pulmonary arteries over here. But the slight difference, on the left side we also have an additional what is known as a ductus arteriosus, which you can see over here. And it is due to this extra development of the ductus arteriosus, right, that you can see the difference in the location of the left recurrent laryngeal nerve compared to the right recurrent laryngeal nerve. And that is what the question have come in the recent NEET PG, that the left recurrent laryngeal nerve goes below the ductus arteriosus. Why it is so inferior in location compared to the right recurrent laryngeal nerve? The reason for it was that it is due to the presence of ductus arteriosus, which is nothing but a derivative of a left sixth pharyngeal arch artery. And this final image that comes out, as you can see below, this adult derivative that comes out, as you can see over here. Okay, now here's the tabular form which I was just trying to tell you guys, that all the aortic arches are being given over here. Okay, right from left to right, you see the aortic arches first, second, third, fourth is different on right and left, sixth is different on right and left. Theoretically, questions might come that what are the different derivatives of these arches, so do try to recall them, read all of them. This is all which I have just explained you, like third gives rise to the common carotid, the fourth is on the left side gives rise to the arch, on the right side right subclavian, sixth on the left side has an additional ductus arteriosus, and a few additional points over here. So guys, these were all the different important topics or important questions that can come from the pharyngeal arches. I hope you liked it, and these are all the important topics which I'm trying to bring you in a short span of time. All the best for the exam, guys, and that's all. Thank you for listening.